All right, so this next question. Can you help me understand and manage ADHD or other attention-related issues? What I like about this question is that they separate ADHD from attention-related issues because, contrary to the name, attention deficit hyperactivity disorder, ADHD is a developmental issue originating from before the age of 10 and usually pervasive in childhood. There are lots of signals as a child that they may struggle with inattention. Now, there's this new thing called adult ADHD. People believe that they're struggling in life and it must be due to ADHD because they can't attend. But again, there are lots of reasons for attention-related issues. It can include anxiety. You could have a head injury. You could have depression. You could have adjustment-related concerns. Your baseline may not be very strong to begin with. In other words, your intellect may be a little bit lower, so you can't expect to have, terribly great attention. So whenever you do an assessment, what you're looking for are some notable discrepancies in intellectual abilities. You're measuring frontal lobe ability to sustain attention, vigilance, impulsivity, things that can kind of assess how the frontal lobes are acting. Now, I have to break this question into two parts because helping someone understand it and manage it are two different things. So you can look for other videos that can talk about managing ADHD, but I think the most important thing to take away from this is that just because you're inattentive doesn't mean you have ADHD. They can often, it'll often suggest that there may be something else going on. So a comprehensive examination will really try and piece and parcel that apart. I'm of the opinion that I think ADHD is a little bit overblown in our society. I've seen, as a clinician, people that genuinely have a frontal lobe disorder, essentially is what that is, a developmental disorder stemming from childhood. And then you have people that have a lot of tough things going on in life and they're struggling with managing it. So before you go and seek a diagnosis that will explain all your woes, consider what I've said.